Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Radiological investigations. So radiological investigation of choice, this is what we are looking at. So the first is the renal artery stenosis. So under the renal artery stenosis, this is the condition. So the imaging will be the renal angiography. And next is the mesenteric. There is a mesenteric arterial occlusion. So mesenteric arterial occlusion, it is a mesenteric angiography. Mesenteric angiography. Then comes the choledocholithiasis. Choledocholithiasis. The choledocholithiasis is nothing but the presence of the bile stone. So bile duct stone. So bile duct stone, here there is the use of something known as the ERCP. So you have the use of the ERCP. Next is the colonic mucosal disease. So what is colonic mucosal disease? So colonic mucosal disease will have the colonoscopy. So you have something known as a colonoscopy. This is better than the barium enema. This is in case of the colonic mucosal disease. Next is you have something known as a primary sclerosing cholangitis. So in case of the primary sclerosing cholangitis, there is a magnetic resonance cholangiopancreatography. This is cholangiopancreatography. Then comes the chronic pancreatitis. So in case of chronic pancreatitis, it is always going to be the MRCP. So colonic mucosal disease, it was colonoscopy. In case of chronic pancreatitis, it is the MRCP. Next we move on to the neuroendocrine tumors. So in case of the neuroendocrine tumors, it is the somatostatin receptor scintigraphy. And moving on to the upper GI bleed, it will be the upper GI endoscopy. And there is also the lower GI bleed. So lower GI bleed, it will includes the colonoscopy. So lower GI bleed, it is a colonoscopy. Upper GI bleed, it will be the upper GI endoscopy. Next is the proximal. So when you move on to the proximal DVT, this includes the venous ultrasonography. And looking at the detection. So detection of and grading. Detection and grading of the stenosis at the carotid bifurcation, So this will include the duplex USG. There is the duplex USG. To learn and grow daily like this, please do subscribe.